Our topic is COVID-19 in man. COVID-19 means pneumonia caused by the 2019 new type of coronavirus infection. The virus has been diagnosed through lab tests and is transmitted primarily between people in close contact about 6 feet with each other and through respiratory droplets produced when an infected person coughs. Its common symptoms are highly similar to those of our virus, such as fever and difficult breathing. Therefore, people can take information about measures such as washing hands, wearing masks, and maintaining physical distance. Here are two reasons that affect men. First, biological factors. Men and women differ in both innate and adaptive immune response, which may be related in part to the specific inflammatory response due to the inheritance of the X chromosome, which contains a high density of immune-related genes. As a result, women usually have strong innate and adaptive immune response than men. So this makes men more susceptible to COVID-19. In addition to immune response, COVID-19 also has a psychological impact on men. In wake of the COVID-19 outbreak, men have less income, low job security, and more responsibility to care for their children at home. All of these factors add to men's stress when they are dealing with other responsibilities, such as work and housework. In a word, the COVID-19 has a huge psychological impact on men because it causes them to have anxiety, depression, and other problems. The risk of COVID-19 in the specific population in elderly and African America. For the elderly in their 50s and early 60s, about 7 will die, which causes more men than women. The risk rates circulate for the elderly as their years increase. The main reason is decrease of the elderly immunity and the decline of the physical. Next.
Green options. First one is register nurse. Assess patient health problems and needs, develop and implement nursing care plans, and maintain medical records, administer nursing care to ill, injured, convalescent, or disbound patients. For home health and personal care is provide routine individual health care such as changing bandage and dressing wounds, and apply topic medications to the elderly or person with disabilities at a patient's home or in a care facility. Monitor or report change in health status may also provide personal care such as bathing, dressing, and grooming of patients. For retail salespersons and stock clerks and other fillers. Last one, before the first line supervisor of retail sales workers, and the last one is nursing assistants.
In regards to policies and programs for men during COVID-19, there are none in place currently, but the CDC has proposed a 5-part plan. The first part is health education, community engagement, and public health outreach. The second part is health promotion and preventative care. The third part is sex disaggregated data in clinical practice and policy. The fourth part is rehabilitation and healthcare delivery infrastructure. And the fifth part is instituting health policy and legislative interventions. Thank you.